Hi, I'm Janice Ronbeck, Communications Manager for Supervisor Dave Cortese. And Supervisor Cortese is here today to answer your questions about COVID-19 and the county's response to this virus that's been with us for 4 months now. So I'll give you Supervisor Cortese.
Yeah, thank you, Janice. I want to thank Janice and Tara, Tavun Nguyen, also from the District 3 Supervisorial Office. They comprise kind of a little communications team that helps put this on, and we get a lot of help from the Vietbay charity and a gentleman, especially by the name of Min here, who is producing our show every week. So I wanted to make sure I start off with a little gratitude, thanking them for giving us the possibility of getting this message out and answering questions in this manner in a way that's a little bit easier than just trying to pick up the phone at the office. So thank you for that. Well, it's been kind of an unusual week. Not that any week since March 16th has been normal by any means, but this one was a little more turbulent, I think, than many of the weeks coming before. If you happen to have been listening in or watching this last Saturday, we had an expert from the county, Deputy County Executive David Campos, who's a public information officer, but beyond that, he's really a specialist in so many different areas at the county. And he was really pleased that the county was coming out with this new risk reduction framework. That's what I call it, a framework, which allows almost all kinds of shops, gyms, especially hair salons and nail salons and things that people have been waiting for. It allows them to open up. And the county adopted those rules, orders we call them. Some people call them protocols. And lo and behold, the state came in and said 2 days later to the businesses, not to the county, but to the businesses directly, you can't open. And it's been very disappointing and really disruptive, I think, to the very good methodical way that the public health department here has been trying to open up and keep things orderly and keep things safe. Now, does that mean Dr. Cody is perfect or the public health department's perfect? No, I'm not saying that, but I am saying that if you look at major indicators, this county all along has been exceeding expectations. We started off as the hot spot in California. We started off with the first community-based COVID-19 transmission known in this country, and we really, as a community, 2 million people here, the population here, listened to what Dr. Cody had to say, struggled with it, but by and large cooperated, complied, and we've done a good job at what I think is accomplishing the major objectives here, keeping our hospitalization low as possible, keeping the mortality rate down, which I just think is absolutely critical. That's what this is all about. If this was just a flu or a cold or something, what would be the big deal? But when you're losing lives, to the extent we're losing them nationwide, to the extent that we're losing them in California, to have a county that's keeping that problem down as well has been encouraging all along. So you would like to think that when Dr. Cody comes out and says, hey, barbershops can open and other hair salons can open and nail shops can open and gyms can open and yoga can open, that the governor or the state of California public health folks would just say, hey, that's Santa Clara County, they know what they're doing. I wish it worked that way. Unfortunately, the state comes out during the middle of this week, earlier this week I should say, and said that those businesses had to shut down. People ask me sometimes, why doesn't the county just tell the state, forget it, we're not doing that? County government. Why doesn't Supervisor Cortese be a vocal leader and tell the state or the governor, we aren't doing that, and buck the trend or buck the orders that are coming from the state? Well, it's important to understand this, and I don't want to get too legalese about this, but it's important to know that the county orders are law and those are still on the books. They're not changing. As far as the county is concerned, nail salons, hair salons, gyms, yoga, all these things can still open up. But the governor and the state have come in and directly mandated that the businesses can't open. So if I were to stand up or get on Facebook today and say, all you businesses, I suggest you just open up and do haircuts anyway, it's not me that gets in trouble. It's those businesses that are now violating state law. And no matter how bold I'm going to be, I'm not going to tell people as a government official, and frankly as an attorney myself, I'm not going to go out and tell people who own businesses, hey, it's okay to violate state law. I don't agree with the state law right at the moment, but we have to figure out another way to get the state to change their mind rather than just break the law. That's not the right way to do things. So I do want you to know that the minute the state does back off, the minute they change or this rule that they have that those businesses have to be shut down, our rules immediately go back into effect. It could be 1 o'clock in the morning and our rules are going to go back into effect because basically they already are in effect. We haven't repealed the rules here in Santa Clara County. We're just, our businesses are just held back by the state right now. So, going back over the week, Saturday after Saturday after Saturday for about 4 weeks, I was really, really pleased, Janice, to be able to say that the number of deaths resulting from COVID-19 over a week's time were so low. Yes, we were still having some, and yes, that's a tragic thing, but to have 1 or 2 deaths per week was such a positive indicator that things were getting better, especially compared to other parts of the country. Now, for the first time in the last 7 days, or for the first time in the last month, over the last 7 days, we've had 11 fatalities. And as we all know, those deaths trail by a few weeks any kind of a surge because it's a kind of disease that lingers and festers, and the death numbers kind of lag. So we have 177 deaths now in Santa Clara County over basically a 4-month period, give or take. That's an awful lot of people, who have lost their lives in a relatively short amount of time in a community that's not used to having people lose their lives in large-scale numbers for any reason. This is not a violent community. This is not a community where death is rampant by any means. So I have to say that I often start off our report on Saturdays talking about that kind of grim detail, but I think it is important to remember that's a statistic that doesn't lie. Hospitalizations is the thing that's really tweaking the governor, for lack of another way to put it. I mean, he has a formula that says when hospitalizations go up quickly, that he puts that county on a watch list, and when you're on the watch list, that means he's likely to have some of your businesses shut down or some of the things that you're doing stop. And that's what happened this past week with the hair salons and such. We went from 2 Saturdays ago, we were at 64 hospitalizations here in the county. Last Saturday, that shot up to 112. And today it's at 146, at least as of 24 hours ago. If that number keeps growing almost exponentially like that, I think unfortunately we're not going to be talking about who gets to stay open, who gets to close, but we might be looking at the state coming in, putting another across the board kind of a lockdown or shelter in place on us. So let's hope that doesn't happen. I think the message out there is remember what we were doing so well in March and April and even early May. I think, before Mother's Day, before Memorial Day, there really was so much compliance going on, people wearing masks, people staying 6 feet apart. We know how to do this. We have to do it again if we can get those hospitalization numbers to stop climbing. They don't have to go down, they just need to stop climbing. And then the state will essentially back off of our businesses and the county can proceed as we'd like to proceed. So that's probably enough right now. We could talk about more things during the course of
I think we have some questions now.
Well, that's good. Let's answer the questions.
Yeah, first question texted in San Jose Mercury News reported that the county is recovering its lost jobs at a faster rate than other neighboring counties. This is good news. Do we know the reason why?
Well, in the 9-county Bay Area region, which is comprised of San Francisco, Marin, Alameda, San Mateo, and so forth, Santa Clara County has been by far the jobs leader for a number of years. So when you have jobs production, it is typically far advanced in Santa Clara County compared to other places around us. So if it was going to bounce back, it would bounce back at greater numbers here, for example, than it would perhaps in Alameda or Contra Costa County. That said, we gained in a short time 122,000 jobs back. That is an amazing number. We've lost over 200,000. We lost over 200,000 just in the first few weeks of shelter in place. So it's wonderful to see that many coming back. I do think that folks in the general public should be reassured by that. I know I am. I'm a resident, a taxpayer, and somebody with small investments, just like so many other people. We don't want this economy to tank for any long period of time. But I know there's been a lot of pressure, even on Dr. Cody. People saying, in a sense, are you sure you know what you're doing? Is it really worth it to try to save lives by killing our economy? And I think what this shows is that this economy will come back in what they call a V shape, meaning it dropped way down sharply, but it'll come back sharply given the chance. So all the more reason we just need to keep this transmission rate down, because you can see that our economy is really trying to come back. And I think that's the best answer I could give right now, but we're happy to see those numbers.
Our next question is from Curtis on Facebook, and Curtis asks, can you describe the steps data goes through between hospitals and the county COVID-19 dashboard?
What steps the data goes through? The hospitalization numbers, because of the fact that we have a huge piece of the health and hospital system here run by the county, a lot of the data is very direct. The Valley Medical Center, O'Connor, St. Louis are all hospitals run by the county, so those numbers are easy to validate. The data comes back and forth. My understanding is there is also, the whole time, on almost all aspects of COVID-related data, there's a tracking system at the state level. For example, the number of cases. Even though it's our county and we have good data and we have good relationships with Regional and Good Samaritan and all the other hospital systems, everybody reports their numbers into the state, including the number of new cases, all the testing centers, whether they're public or whether they're commercial, and then the state comes back each day and validates those numbers. For example, at the outset of this program today, I announced that we had 95 new cases in the last 24 hours. But our own county council cautioned us this morning and said we probably had a few more than that, because those are the ones that are locally known. That's our count, meaning that is Santa Clara County's public and private sector count. But it hasn't yet been validated by the state, and generally the numbers go up a little bit when the state takes everything else into account. So I hope that answers your question. It's not a very data-driven scientific answer to exactly how that data flows, but at least wanted people to know that the state is going back and forth constantly with the counties to validate.
I was wondering, with 50 testing sites, does that data come in at different times because they're widespread and a number of different health systems are working with those?
Yeah, the number of people tested would come in fairly immediately. That's that's real-time data. I think the issue now is becoming how fast do the test results come out, and so there's a little bit of a lag. A not so bad lag has been about 48 hours. That's kind of an expectation in Santa Clara County, that your test results could turn around that quickly. But there has, for a variety of reasons, including high demand on testing capacity, there's been a little bit of a slowdown in getting lab results turned around. And of course, that can also slow down that whole cycle. The state can only validate the numbers they're actually receiving. So anyway, I'm not a number crunching expert on this. I'm just telling you, when I read our daily reports, that's the cycle of data that's described to me by our own public health department and county administrators. So if you want more information, if you'd like to dive into that more deeply, if you're a logistics kind of a person, that's great. And we would be happy to put you in touch with the Emergency Operations Center Logistics Department on Monday, and they can explain that process to you a little bit more. Just call our office, and I think all the numbers are right there on the screen.
We have another question.
Another question is, would it be possible to open businesses like hair salons, barbers, and nail salons outside in parking lots? It seems like having them open outside may be safer.
Yes, another great question. This is another one of those issues where there's a conflict between local law and state law, and it's one step more complicated than usual. The county is fine with outdoor haircutting. In fact, the county is generally fine with shops moving their activities outdoors almost in every sector. There hasn't been a lot of limiting language about that in our county. Sarah Cody and the attorneys that write these rules for her have been saying, yes, move it outside, including barbers and hair. In the state, at the public health level, in other words, the governor's office, has also said, move it outside. They haven't really commented on banning any businesses outside that have to do with, hair salons, etc. But there's another agency called that regulates cosmetology, and which licenses cosmetologists. And there is an old rule in that state agency that says you have to cut hair in your establishment. And you're only licensed to cut hair in your establishment. So there's a question raging out there, and we've been pushing hard on the cosmetology agency to clear that up, because the raging question is, isn't your patio or your back parking lot or just outside your front door, isn't that part of your establishment? If you have lease rights there, if you're allowed to park your own vehicles there, if employees come in and out there, why isn't that part of the establishment? So we're pushing as hard as we can on that, and hopefully we'll make a breakthrough, because I think it's frankly just kind of a dumb thing if we're trying to push people to get to do those kind of activities outside, to have an old state law or a state agency stopping us from doing that, really just for some technical reason. So we'll keep reporting on that. Hopefully by next Saturday we'll have a better answer for you that everyone's moving outside.
So our next question is, there have been reports that PPE shortages for medical personnel continue to be an issue. How can we alleviate these continued shortages?
Well, the county is in a much better place now to help with that. We always were willing to invest in buying more masks, including N95 masks. And of course, as I just mentioned, we have a huge health and hospital system, and we have to make sure the frontline workers are protected. Early on, as you may recall, the N95 masks were in short supply. It was just not a matter that the county didn't want to pay for them, we couldn't find them. But that is not a problem anymore, at least as of now. In fact, I'm happy to report in the last 24 hours that the county just ordered another 1 million masks, and the county will double down, I believe, in a very short time here, and order another 1 million just to make sure that we have an ongoing supply. Remember, there's some issue about reuse, especially for frontline workers. They've experimented with sanitizing those masks and cleaning them, but the best thing is to just have a large supply like that. If you can help with masks, if you want to donate some, there are a whole bunch of other people besides frontline hospital workers that need them, and please contact my office about that. Again, our contact information is on the screen. We do intend to be doing a couple more mask drives to get masks out to the community. As we can see, we have 4 zip codes: 95116, 95127, 95122, and 95148, which are very hard hit by COVID right now. We want to make sure that people who are at retail counters and such have the right masks on.
So I know that the VMC Foundation also collects masks. We've been coordinating with them as well.
Yeah, we've had a lot of charitable help. Over the last several weeks, we had a lot of charitable help in terms of folks who just donate masks. Some of them have been just philanthropists. Some of them have been people that are just trying to do a good deed out of their own pocket. Some of them are organizations. The organization that hosts our Saturday program here, Vietbay, has donated hundreds and hundreds of masks, not only through VMC, Valley Medical Center, but also directly out in East San Jose to people who need them. I was here one day weeks ago at this same location where we are doing this video today, and there were literally hundreds of people lined up waiting for a mask. So it's still an issue. I don't want anyone to think they can just relax and we don't need any masks. But for now, especially for our frontline healthcare workers, there's an adequate supply chain, and the supply chain itself is not broken. None of us know how long this is going to last, so expect that we might be asking for help again in the future.
Yeah, so one question on Facebook is from Lawrence, and they mentioned that the governor and the county had to make cuts for a balanced budget, and he's wondering what the county and the state is doing to remain on track.
Yeah, it's a great question, Lawrence, and it's a big headache for county supervisors. It's a big headache for state legislators, and it's probably a really big headache for the governor. The state has a $54 billion deficit projected for this year. They're trying to balance their budget to that number, meaning they have to use reserves that they've been saving up, freeze positions, use attrition, which means somebody quits, you just don't fill that position. Things like that. We're doing the same thing at the county in terms of a strategy. Our deficit is over $300 million right now. To put that in perspective, typically the county has been running about an $8 billion budget. So those are pretty big numbers to balance with, especially since, oddly enough, the cost of living around here doesn't seem to be declining at all. Rents are staying up. Grocery prices are staying up. Things are continuing to cost more, and that same cost gets passed on to government too. Government procures things and has to pay the same kind of cost of living increases as everybody else. So this is not a good situation, but the strategy is sound, I think, for the next year. And remember something really, really important, that our federal tax dollars are coming back to us in stimulus packages that we have been using to backfill some of these COVID costs. So when you hear that the county is investing so many $1 million in COVID response, remember a lot of that is reimbursable from FEMA and through other government stimulus programs at the federal level. And there's actually one more government package that we're waiting to have come out called the HEROES Act, which will benefit counties and local governments specifically in terms of some of these costs. We have invested thus far. My numbers might be a couple days old, but when I looked during this past week, about $147 million directly in COVID relief just from this county alone, just from our own treasury. So it's a lot of money.
We're getting a lot of questions, I know, in the office about schools reopening, and of course we hear that on the news as well. On Friday, the governor came out with new guidelines. Can you talk a little bit about that and how it affects Santa Clara County?
Yeah, the first thing that I have to say as kind of a backdrop is there's a whole bunch of different government agencies right now that are regulating education. The county has a little bit to say about it because Sarah Cody, our public health director, is able to put certain restrictions or guidelines out there that the school districts have to follow. But at the same time, if the governor puts out more stringent restrictions than the counties do, then that's what prevails. And of course, to make things even more complicated, within those restrictions, once those restrictions are out there, the school districts then make the final decision whether to open up or stay closed as far as classroom work, to continue distance learning only, or should they do some distance learning and some classroom work. That's all a local decision at each school board, and there's over 24 school boards in Santa Clara County. There's many districts here that have their own ideas about how things should go. So what we heard from the governor, to answer your question, is he is basically saying that if you're a county that's on the watch list, which is almost every county in the Bay Area right now, with the exception of San Mateo, if you're on the watch list, you cannot open up your classrooms for student activity, period. That means distance learning only. And we're only a couple weeks away from August. Normally principals and teachers have everything planned by now. They have their classrooms ready. Parents, of course, have their plans made. Kids know what they're headed into. All of that is a little bit somewhere between chaotic and just put on hold right now. So I think it's one of the most challenging impacts of coronavirus, of this whole shelter in place kind of strategy that we're going through, is schools. There's certainly some business hardship, but the hardship on kids and anything that sets back their learning is going to be obviously very difficult to fix or reverse in the future.
Yeah, I believe the governor said that you have to be off the watch list for 14 days before you can have any in-person classroom, which would, of course, also, as we've talked about before, it's not a normal classroom. It's a classroom with a lot of distance, a lot of physical spacing, kids wearing masks, teachers wearing masks. But the other part of that I was wondering about is distance learning, is that if that's going to be with us for a while, and that's online learning, what happens to those families that don't have access to the internet or have devices? I know that you're working hard on that, and there's something coming up Tuesday on the board agenda about that.
Yes, in conjunction with the County Office of Education and with hope for a partnership with the City of San Jose and some other folks in the community, I put out a recommendation a couple of weeks ago at our Board of Supervisors meeting that was approved, that would basically equip 15,000 more households with Wi-Fi and either tablets or laptops, some sort of devices for kids to use. That was something that we always wanted to do, and I suppose probably should have been done sooner. If I'm going to be a little bit critical of government and the inability to get that done, it can't wait now. It's no longer just some kind of luxury or some kind of aspiration to close the digital divide among 15,000 households if you're going to tell those kids that they have to learn from home, and they have to learn from distance, and they have to learn in a virtual way. Then you've got to give them the hookups to do that. And that program is about $7.2 million, the county's share. The city of San Jose has pledged multi-million dollars over the next many years to close that digital divide, and they're talking about accelerating some of their investment to help get this done. But you can see why we're doing it with school about ready to start again, with the governor saying kids can't go back into the classroom. It's just not right to have kids out there that basically would be twiddling their thumbs and not able to essentially attend class at all over the internet because they have no internet. So we're trying to fix that. Earlier somebody said, how do you budget for stuff like that? We've asked the county administration to make sure to qualify that investment for for federal COVID reimbursement. And the federal government in the last stimulus package did single out digital investment that is needed to close a gap as something that is federally reimbursable during the coronavirus pandemic. So if we have to use some local taxpayer money, we probably just have to do that. But the fact of the matter is, it looks like we'll get some federal assistance with this.
Well, it's also critical because with community centers closed and libraries closed, there isn't that public access also to the internet and to computers.
Yeah, it's not, even if the libraries were open, to a small degree, 6 feet apart and all of that, it's hard to fathom how you could tell kids and families that you can't have kids go back to school and have the teachers managing them and just let them start flooding into libraries. Those aren't good answers or easy solutions. So you're absolutely right.
Yeah.
This is really the only way to do it right now. But if somebody has a better idea, we'd love to hear it, and I mean that very sincerely.
We have a few questions about testing, so I thought I'd combine them. Catherine asks if the county's doing antibody testing, and someone texted in and asked if we're tracking how many folks are asymptomatic that tested positive for COVID. And lastly, someone texted and asked how long testing results should take.
Yes. Let me start with the last one first. There's been an expectation that testing results would turn around in about 48 hours. I think there's been a little bit of slippage here and all over the country recently, and it's because people are starting to get tested in large numbers. We've had as many as 700 to 800 people a day at our local testing centers, at local high schools and pop-up centers, for example, which is good. It's really good. But cumulatively, that puts a lot of pressure on the laboratories that are actually turning those tests around. So that's what the expectation should be. If it slips much more, I think you'll hear a lot from my board, the Board of Supervisors, in terms of how can we invest and help these labs turn things around more quickly. Is there something we can do? And I'm not sure there is, but we'll find out. The question about antibody testing is, unfortunately, this is yet another Saturday town hall where the Federal Drug Administration has not yet approved an antibody test. The ones that have been experimental thus far have a high error rate. And of course, the problem with that is if you're going to use antibody testing to establish immunity, for example, the immunity of teachers or children to go into the classroom, it would be a wonderful thing if it was accurate. Test them. If they're immune, great, we have nothing to worry about. Let them teach school. But the fact of the matter is, if the test has a high error rate, then we're playing Russian roulette with our teachers and our children, or our hospital workers, or whoever it is that's in that group that we're trying to test. So that's a big problem. And the other question I may have missed. There were three parts to that one.
Asymptomatic, if we're tracking that.
We're tracking asymptomatic. I don't know where those numbers are though, because I haven't seen them on our dashboard. I'm glad somebody brought it up, because we will be meeting this Tuesday as a Board of Supervisors. We'll have another COVID report on Tuesday, July 21st. Everyone's welcome to tune in to that meeting if you have the patience for it. It is streamed. All those meetings are streamed. They're public meetings. You could call in, and there's instructions for doing that. The meeting starts at 9:30 a.m. on Tuesday, sometimes goes for several hours. But again, call my office if you're curious as to how to hook up to that meeting, 408-299-5030. And I do intend, Janice and Tara, to ask that question Tuesday, is to how can we get a little bit finer information out there in terms of things like this, asymptomatic versus symptomatic test results. We have said all along, and we've heard statistics in general, that sometimes in some groups as many as 1 out of 5 people are asymptomatic carriers. We've heard lower numbers than that, but I think this question is great, because by now the numbers shouldn't lie. We should have a pretty good sample.
I'm also wondering why we don't have keep track of the number of people who have recovered. I know on some of the national and global databases that I look at, they always have a number for recovery. Is it because it's just so difficult to track that?
Yeah, it's kind of addition by subtraction to some degree. You know, if people aren't in the ICU and they're still alive, then they recovered, right? You can subtract those numbers from the number of people who have tested positive and said everyone else has recovered, that's why I keep, I want to say it's been a good number. It's been a good percentage. That's why I keep saying, as tragic as it is, 177 deaths after 4 months in this region, in this area, not the region, but just in this county, indicates a high recovery rate here. I think that's good. But it's another number we could ask them to just do that math. People do want to see that, show that number on the dashboard, and I think it would just make it a lot easier for people and more accurate than people just trying to do it on the back of an envelope and subtract themselves.
On the testing dashboard, they do have the number of course, positive cases. They also have the number of negative cases, so that does give one indication that most of the people here get tested or not.
Yeah, it's. I think sometimes people ask that question because they really want to demonstrate the fact that the vast majority of people recuperate. There's no question about that. Even in some of the major hotspot areas in the country, there's been pretty good recovery numbers. But just remember, if we lost 1% of the population of Santa Clara County, it would be 20,000 people. So these statistics can be misleading sometimes when you say something like, hey, only 1% or we're only losing 1% of this or that. 1% of a lot of people is a big number. So that's why the public health people are very, very worried about the way things have been going lately.
So we have a question texted in about gatherings, and they're asking what sort of gatherings are allowed indoors and outdoors in Santa Clara County, and why was this decision made?
Gatherings are still a legacy of the shelter-in-place original order. If you remember, and I think most of you do because it's been difficult, but if you remember exactly what the original shelter-in-place said before any businesses started to open up, it was stay at home, stay in your family cohort, meaning the people you live with, and don't commingle with other families, other neighbors, or have other guests over. Do we have a change in that? No, that's still the case in Santa Clara County, and it's still the case in the state of California. There's really no such thing as, a social bubble or a party of 60 people, for example, that's okay, or some other number that's okay. Especially right now, with all these counties on the watch list, the state has been pretty clear that people should not be doing that whatsoever. Is there non-compliance? Yes. Am I aware from time to time of people who are in that category of yes, but something just happened, a tragedy in somebody's family. We're going to get together with 6 people. I hear about things like this. My advice would be don't join in. My advice would be to gently let people know and remind people that that's not okay. That's what adds to these hospitalization numbers because it increases the transmission rate. And in turn, when our hospitalization numbers go up, our governor tells our businesses to shut down. So it's a win-lose proposition. Somebody wins because they have a little party, everybody else loses, and a bunch of businesses get shut down. So I wish there was another way to say it, but I don't want to sugarcoat it. That's how things are going right now.
That also brings up the question of enforcement. How is not only those kind of gatherings, but what about just businesses? We got some calls of people. I got one yesterday at the office about someone who thought that a barbershop was actually cutting hair like in the back with the lights off. So I mean but who enforces that kind of thing?
There is enforcement here in the county. It's not done by the public health officials, but it's done by the DA's office, the district attorney, through a hotline. And actually there's another line that there's another way to report online. You don't have to give your name. You can do it anonymously. We don't go out of our way to encourage people to do legal reporting, because a lot of the complaints we hear are relatively low level. We don't want to turn us into a county of vigilantism. But when you see something that just is really over the top, really looks like a complete disregard of shelter in place and the rules, yes, I do think you should say something. Maybe you could give that information if you have
Actually,
it, Jess. You must have that number somewhere.
Yeah, I have the number to call to report a business that you feel is not complying, and it's 866-870-7725. That's 866-870-7725, and that's actually the hotline that the Office of Labor Standards Enforcement is using now to answer questions of businesses. You don't have to ask it's not just to turn in businesses you think are not in compliance, but also just questions about, I mean, there's so much information out there now. I mean, am I compliant if I do this? Or can I do this? Or, when will I be able to do this? So there's a lot of good information there at this hotline.
Yeah, and it's my experience with it, in our limited experience between my office and the enforcement office, is that they're first going to go out and send somebody out to make inquiry and try to break the activity up. If it's a soccer game or it's somebody having a funeral wake, we've seen situations like that. I mean, your heart goes out to people, but your heart goes out to people who can't have a funeral wake either. So it's, there's an aspect of this that just has to do with fairness as well, and that's why I say, these are the kind of violations that really could easily add to an outbreak or cause an outbreak, and cause everyone to lose. So better if you're worried about it, really worried about it, call it in. That's my suggestion, and you can always contact my office and we'll help with that.
So we have a question texted in. It would be nice to know how long it is taking people to recover from COVID and what symptoms they're experiencing after they leave the hospital. Also, how many people have gotten COVID twice?
I don't think we have statistics of any real substance in terms of second round of COVID infection yet. And the reason I say yet is I hope that there's immunity, that our immune system reacts and protects us after one case. And that's what I think all the doctors, medical professionals are hoping. But remember, we're only 4 months into the first round of this, really. And it's hard to say if you had it in the spring, whether or not you could get it again in December, when there's a whole bunch of people walking around coughing and sneezing because they have the common cold. And the problem's going to be if those are asymptomatic carriers as well, or if they just also have COVID, can they infect you again? So we aren't really going to know, I don't think, on that detail, on that statistic until later on. On the issue of how long it takes to recover, it varies widely, really widely. I just made a business call on Thursday for the county of Santa Clara. I asked the person on the other line, as we commonly do, how are you? How's your family? And he said, I have really good news to report. My partner was just released after 4 months of being hospitalized with COVID. He fought and he fought and he fought, and he made it. So some people have been tied up for that long. Other people seem to have the symptoms, at least, for maybe 3 or 4 weeks, 2 weeks. It just varies. There's no set time. When you hear 14 days, that isn't how long you have COVID. That's how long it takes it to incubate, somewhere between 4 to 14 days. So 4th of July was July 4th. Today is July 18th. You see these hospitalization numbers going up. You see the transmission rate going up. You see the infection rate going up. Quite possibly, it was 4th of July activity that took 10, 12, 14 days before it incubated or seeded inside the body and became manifest as COVID-19. That's what we're seeing. Once it becomes COVID-19, you can have the disease for a long, long time.
We also know that in the fall and especially the winter, we're going to have another flu season, the regular flu season. So that will also perhaps complicate people in not knowing, what they have, if it's a common flu that comes every year or if it's COVID-19. So that's why testing is so important.
Yeah, this is the time of year in so many ways, socially, in the middle of summer, when people, tend to not give each other colds or to necessarily be in close contact socially, other than their immediate family. A lot of that changes in wintertime, even in California, right? I mean, there's it's a human nature for people to be closer together, to convene closer together, to share each other's jackets and clothing, and for kids to mix up their clothing amongst one another, and for people to just get a common cold. I mean, that's why we call it the common cold. And all of that just happens to be very troubling when it comes to the transmission of COVID-19, because the same sneeze that would happen with a common cold could very, very easily be simultaneously carrying the coronavirus and then lead to the disease entering the body. So this is what people are worried about. We don't want to be right about any big surge coming, but we want people to be aware that there's a whole bunch of indicators right now that we could have a big surge like that if we don't remain disciplined. And I think we've learned over the last 2 weeks or so that when this virus comes back, it comes back with a vengeance.
We also seem to have nationwide and maybe even somewhat here a debate about face coverings and masks, and it's become hugely political, which of course health officers, that was not the intention, and yet Dr. Cody and other health officials keep saying it's the one tool we have that works, and if you wear a mask, you're protecting other people and you're respecting other people, and it's that and the distancing. So it seems, I don't know if you have a few words to say about that, but it seems like those are the one things we can do, or the social distancing and wearing face coverings and
yeah, have a mask with you all the time. We come in and out of the studio here with our masks. Once we're in here, there are people, a small group of people here, 4 today, spread out, 6 feet or more apart. You have to keep paying attention to all that. You have to do it that way. This is, get a good quality mask if you can. People are giving them away in some places. If you drive, keep one in your car. If you have a locker at work, keep an extra one in your locker, keep one in your desk. Just don't be without it. Make it second nature, even if you just get up to go to the bathroom and come back, which happens even in restaurants, right? Put the mask on, put it back on for a few minutes and take it back off. It has to be not only 100% compliance, but it should be second nature. And I think there should be some peer pressure. I don't want anyone to get in an argument with somebody about wearing their mask or not, but I think if 9 out of 10 people are wearing their masks in a group, maybe and people should be urging that 10th person to get their mask on, and that's just the way it's going to need to be for a while. And
Yeah, I actually saw the other day what you were talking about. There was a couple walking a dog, and they had masks on. Another young woman was walking toward them, didn't have a mask on. She looked back at them, and then she got inside her purse and took out a mask and put it on. So it's exactly what you said about not so much pressure, but just good example. I mean, good. Okay, if they're wearing them, maybe that's a good idea for me to put one on too. So I think,
yeah, I mean, we're social beings, and social animals, so to speak, and societal. It's not just pressure. It's we used to use that word all the time a few years ago, trendy, right? What's the trendy thing to do? Right now, it's a good thing if the mask is a trendy thing to do. I mean, let's face it, sometime we're going to look back on this era at all these digital photographs that people are taking and say, oh, I know when that was. Look at all those people with really bad haircuts and masks on, and that's just something we should embrace right now. Just know that that's the era we're living in temporarily, and we're going to get out of this, and it's going to be part of history at some point. But right now, it's still a big issue.
So we have a question texted in. I would like to know how shelters are being set up to keep the homeless safe from coronavirus, and how is the county interacting with the state to do this?
That's really a really good question, and Janice, I know you put a lot of effort into policy work around the homeless over at the county. I've been getting a lot of emails from constituents, from residents of the area, just over the last few days, kind of critical about, why aren't we doing more? Why is it costing so much when we do something? And why have there been these, mistakes by some of the cities and some of the folks, even the state, with regard to providing trailers and things like that? The county's strategy has been primarily to lease up motel rooms that are vacant and move vulnerable homeless or unhoused into those hotel rooms as quickly as they can. They've done a lot. The only problem is it doesn't seem like a lot because there's so many unhoused, there's so many homeless people. When I say a lot, we're close to 700 motel rooms now that have been leased and occupied. That's all work that the County of Santa Clara's housing department has done. Wow, almost 700 homeless, put into motels. That's great. Well, the problem is there's 10 times that many out there, literally, and it's an area where we're very vulnerable as a community. They are very vulnerable, and we just have to keep our foot on the gas pedal, so to speak, and keep increasing those numbers. This is not a time where we have time, to build expensive shelters or anything like that. So that's what we're doing. If you want more information or more information on how you can help the homeless, please contact our office. Again, the numbers are on the screen. There's plenty of work to do out there, including volunteer work.
Yeah, and I think one sort of, I guess you could say, positive thing that came out of this is that the cities within the county stopped sweeping the encampments, which most of the authorities would get a complaint and then people would be forced to move. But while that was happening, that's not happening anymore, but it has made those campsites even bigger, and so people are a little concerned. The health officials are concerned about making sure that they get tested, and also, which was one of your initiatives, is to get the information out to them. And I heard a report from the Valley Medical Center or Valley Homeless Healthcare Program that they were stepping up testing, but just getting the information out to people, not only in homeless camps, but in those zip codes that you mentioned before, and that's also on the agenda for Tuesday, to try to make a much better effort to communicate to not only but those who are just the most vulnerable and don't have they might not have cell phones or computers, or we do so much messaging now online. but they may need a pamphlet, or they may need a handout, or they may need just someone talking to them about, here's what you do.
You just think of all the things we've talked about today, and the fact of the matter is, I've been out to homeless encampments a couple times in the last month with PPEs and a mask on and talked to people. Most of the questions that people ask today, they do not have the answers to, if they live in a homeless encampment. They have no idea about percentages, about what's happening. They don't even know about asymptomatic carriers. They think if somebody's not sick right next to them, then they're probably okay. And the rest of us have learned that that's not the case. So there's a lot more work that needs to be done. And like I said, we'll keep on it. We'll keep working on it.
I think we're almost out of time, but I wanted to say that next week, July 25th, our guest will be Dr. Sarah Redman, and she's going to talk about contact tracing. So please join us then. And thank you for joining today.
So who's not going to be here, you or me? I think maybe you and Sarah.
No, I think you're going to be here.
Okay. All right. We'll see everybody next week.
I'll be somewhere in the room.
Call us during the week if you have more questions. We're happy to answer them. Thank you.
Thank you.